the story. We just hadn't gotten any farther yet. We just stopped that for a while. Statistically, you cannot, if I sat here and talked for 2 more hours, you'd remember the last 10 minutes and the first 10 minutes. It's time for an activity. Or not. We're not through, we just stopped for now. Let's do Harry Smith. Harry Smith is 70 years of age and a male patient who was admitted to the medical surgical unit with acute community-acquired pneumonia. Don't ask me what this next thing is. He was diagnosed with paraseptal emphysema 3 years ago. Emphysema is on Thursday. The patient smoked cigarettes 1 pack per day for 55 years and quit 3 years ago. The patient has a history of hypertension and diabetes controlled with oral diabetic agents. The patient presents with confusion as to time and place. The family stated that this is a new change for the patient. So what do we have? We have a 70-year-old male with a 55-pack-year history of cigarette smoking and emphysema, who quit 3 years ago, and he is only oriented to what? Person. So he's oriented times 1, right? The admission vital signs are as follows. Blood pressure 90/50, pulse 101, respirations 28, and temperature 101.5 degrees Fahrenheit. Pulse oximeter on room air is 85%. What's normal pulse ox? CBC is what is normal without emphysema? Normal pulse ox is greater than 95%, right? CBC, WBC is 12,500, platelets 350,000, hematocrit 30%, and hemoglobin 10. Arterial blood gases on room air are pH 7.3, PaO2 55, PaCO2 50, bicarb 25. The chest x-ray reveals right lower lobe consolidation, presence of apical bullae, don't know what that is, flattened diaphragm, and a small pleural effusion in the right lower lobe. Lung auscultation reveals severely diminished breath sounds in the right lower lobe and absence of breath sounds at the base. The breath sounds in the rest of the lungs are slightly decreased. The patient complains of fatigue, shortness of breath, and cannot finish a short sentence before the respiratory rate increases above the baseline, which is already 28. Okay? And his nail beds and lips turn a bluish tinge, and the pulse oximeter decreases to 82%. Not tolerating much activity, is he, if he can't even talk? The patient is diaphoretic. What's that mean? And is using accessory muscles. What's that mean? Right, when he's breathing, he's not using his diaphragm, he's using his accessory muscles. The patient coughs weakly, but he does not raise any sputum. What nursing assessment findings support the diagnosis of pneumonia? Nursing assessment findings. Confusion. Let's talk about all of his vitals.
Well, it depends on what his normal blood pressure is, whether that's low or not.
That's pretty low for a 70-year-old who's diabetic, but
And who has hypertension.
with a history of hypertension, yep. Has a history of hypertension and he has a blood pressure of 90/50. Ooh, that's pretty scary.
And lung auscultation with the diminished breath sound.
Okay. So the nursing assessment findings are fever, right? Diaphoresis, complaint of fatigue and shortness of breath, and inability to complete a short sentence before having an increase in respiration, and a decrease in pulse ox, okay, and the development of cyanosis. And so when you look at tachycardia and the atelectasis, you can't hear the lung sounds, right? These also support the diagnosis.
What was the last
What
one?
was the last one you said?
I didn't get it.
Decrease in pulse ox and a.
Development of cyanosis. Remember, his pulse ox was 85 when he came in, but as soon as he started to talk, it dropped to 82. So all of those things support the diagnosis of pneumonia. Okay? And when you've got tachycardia and you've got atelectasis, and how can we tell? We don't hear any air moving, right? Okay, so he's got at least partial atelectasis. Now, in the elderly, a change in mental status is often the first sign in a previously unconfused, previously alert elderly person. The first sign that they have an infection is often a change in mental status. They forget where the bathroom is. They forget what day it is. They forget to eat. They look at you like you've spoken a foreign language. There's something, and if they're in a place where, in a family situation, the family will just sometimes pass it off, oh, his dad's getting confused. But dad wasn't confused before. So alteration of mental status is extremely important in the elderly, particularly with infection. So those are the nursing assessment findings that support the diagnosis of pneumonia. Want to go over them again?
Yes, sir.
Fever, diaphoresis, complaints of fatigue and shortness of breath, an inability to complete a short sentence without a change in respiratory status. Rate goes up, oxygenation goes down. They get cyanotic, blue around the lips. What's capillary refill? Is there much of any? If their nail beds are blue anyway. Okay? So those things support the diagnosis. He's already tachypnic, he's already a little tachycardic, and you're making him more tachypnic by just asking him to say, hello, my name is Harry Smith? Is that his name? Harry Smith? Harry Smith. I'm 70 years old. Okay? So, frequent sign of infection in elderly is altered mental status. Right. And particularly in a patient who has previously not had that kind of alteration. So now, let's move on to the diagnostic findings. Which diagnostic findings support the diagnosis of pneumonia?
The ABGs, or okay, pH is low, it's acidic.
Diagnosis of pneumonia, but does that diagnose pneumonia specifically?
No,
The chest was
Let's look at the things that specifically do diagnose pneumonia.
the white blood count.
The white blood count is elevated. What's the normal white blood count? Usually usually 4 to 10. You may see some range there, but usually 4 to 10 in a non-pregnant person. Okay? So he's got a white blood cell elevation to 12,500. And the chest x-ray reveals right lower lobe consolidation, pardon me, please, and a small pleural effusion, and these are complications of pneumonia. Now, we haven't had emphysema yet, and I haven't studied it, but it says here on my little sheet, the apical bullae and flattened diaphragm are suggestive of the comorbidity of paraseptal emphysema, a type of chronic obstructive pulmonary disease. We'll do that. One more time?
Yes.
Just like that? The apical bullae and flattened diaphragm are suggestive of the comorbidity of paraseptal emphysema, a type of chronic obstructive pulmonary disease, COPD. So we'll get into some of those changes. We talk about AP diameter and all that. We talk about emphysema on Thursday. Harry's a sick individual.